I am one of the emergency doctors that are here at Friendship. We have a lot of veterinarians. There's a lot of veterinarians like me who primarily just do the emergency side of things.
You have all these departments, dermatology and radiology and oncology. I mean, there is a lot with animals that, you know, I guess when you call it an animal hospital, this one really is.
Yes. So as medicine continues to improve, the demand and the quality of medicine begins to improve as well. And so those services are available. Even 25, 30 years ago, maybe some of the same interventions that we could have done for people wasn't available at the time, and now it is for dogs and cats. And so we routinely give things like blood transfusions and chemotherapy. We even have placed pacemakers in dogs, which is such an amazing to be a part of, so that our dogs and cats can live longer.
Dr. Klippen, how did you become a veterinarian?
Well, it was a long road. I loved working with animals even as a little girl, volunteering at the shelter, as well as kind of some of the rescue things with my Girl Scouts troops. And so it kind of was second nature to kind of come into this field. I come from a family of nurses, and so caregiving was all around me, and it was something that I felt very strongly about.
Did you have animals in the home growing up?
I did. I had quite a few. In fact, my mom and I think back of the dozens and dozens and try to come up with all the names to see how well our memories are working.
What made you choose to go the emergency medicine route?
I am one of those people that is a adrenaline junkie. And so the fear of the unknown, of things that are coming in the door, I actually get quite a rush.
The thrill of the unknown.
It is absolutely the thrill of the unknown, because I'm seeing very, very sick patients, and patients that probably may not survive, and when I have the ability to help them and make them survive and leave the hospital to be with their families is such an intense rush that it makes me keep doing this.
It's very clean, very in order. It feels like, it's a hospital.
Absolutely, absolutely. We have every specialty, the same that you would get if you were to go to a human hospital.
And taking such tender care of the doggies, who are, they don't always know what's going on. And I always wonder that with veterinarians, they don't always know what's happening, and you have to somehow reassure them. How do you do it?
Well, a lot of it is learning as you go, in regards to body language and knowing when an animal looks frightened or potentially can be in pain, because they don't give the same sort of cues that you or I would, and so that's important information that you begin to get a knack of as you continue to practice.
The way you describe your path to this job isn't like many of us, where we just sort of poked and prodded here and let's see where I end up. It's more of a vocation, it sounds like, for you.
I think that it's totally a labor of love. Veterinary medicine, it's hard. We work long hours. It's a very physical profession as well. A human doctor, a medical doctor, is not getting on the floor in odd positions to examine their patients.
Right.
And so it's hard on the body. So it truly is a labor of love. Why all of us do it.
When someone comes to you, and I'm sure young people do quite often, and say, I want to be a veterinarian, I want to wear that coat, and I want to treat these dogs or cats, what's the best advice you always give them?
I will never dissuade anyone from becoming a veterinarian, because I have had so many experiences and I've had a lot of fun in my career. But I also know the challenges of getting to where I am today, as well as preparing for the financial burden through the extended amount of schooling that's taking. I do believe that there is a lot of sadness that comes along with it. That's kind of where emotional intelligence, as well as having the ability to go home to someone that you love, whether it's your own furry animal, whether it's your small child, whether it's a spouse or somebody else. Bonding with an owner is very important, and I may only have minutes to be able to do that, and I have to have your care as well as your trust that I am going to do what's best for your pet. And so it does become treatment of not only the patient, but sometimes the family as well.